Welcome to the 7th video in our virtual Grant Round series here at Teachers College, Columbia University. In this video we focus on stress in the lives of healthcare providers. There is the potential for stress, although it may not occur.
Dr. Wallace and I want to go back and consider the position of the healthcare provider, who can find treating diverse and different patients to be stressful.
Yes, Michelle. This is important, because, in contemporary times, there is a lot of talk about political correctness, and attention is being paid to what one should do in certain situations where we encounter diversity in a patient.
For example, what is the politically correct thing to say or do when you're referring to someone who is transgender?
Does the patient want to be called he or she?
What if I, as the provider, accidentally call the person he, even after told they preferred to be called she?
Now that you are taking this brief cultural competency training, you may find that your old automatic responses, or socially conditioned cognitions are a problem, and coping with how stereotypes about members of certain groups just pop into your head is also a problem. This can be stressful.
Now, you may feel stressed out about possibly having a negative stereotype about members of a certain group slip out of your mouth. What if you are at work when it happens?
What if you make an inappropriate joke walking down the hallway, or on your way to the cafeteria at the hospital or clinic?
What if you are standing in line to see a movie or to be seated at a restaurant, and your friends start joking or speaking in a stereotypical way about people who are LGBT or MSM?
What if your coworker is a member of the group mentioned in the bad joke? What if you do call the transgender patient he, even after told they prefer to be called she?
We are all human.
And human beings are capable of making mistakes. In fact, one of the most powerful ways of learning as a human being is to make a mistake, realize you made a mistake, and then to make a concerted effort to do something differently in the future.
So, do not be afraid if you made a mistake in the past, or make a mistake in the future. The goal is to learn as much as possible, so mistakes can be avoided in the future. Or, to learn what to do after you make the mistake.
One can always apologize, and then proceed with greater sensitivity and awareness, as you strive to learn, practice, and then master what it means to be culturally competent. That is the purpose of this virtual Grant Round series, assisting you in making progress in moving toward the goal of becoming culturally competent.
So, let us return to the topic of us all learning new A, B, C's, as healthcare providers. As healthcare providers. Remember A stands for our effects or feelings, B stands for our behavior, and C stands for our cognitions, or thoughts.
When our affective, behavioral and cognitive responses to diversity are adaptive, then we have made progress in becoming culturally competent. We are learning new A, B, C's.
However, when our affective, behavioral and cognitive responses to diversity are maladaptive, then, we have some homework to do. In order, watching these videos in the virtual Grant Round series is one way of doing your homework.
Also, recall that while we may be making things sound quite simple by talking about learning new A, B, C's, the material being offered is rooted in integrated theory and evidence-based approaches, including my experiences conducting training workshops with professionals for more than 2 decades.
The material is actually quite complex, but Dr. Wallace breaks it down so it is very simple, easy to learn, and not intimidating to hear. Let's start with the letter A, or affect, our emotions.
Now, think about your FECTS, or feelings in response to the stress of encountering someone who is different from you, perhaps a patient who is either LGBTE or a MSM.
Your affective or emotional responses can be either adaptive or maladaptive. Examples of maladaptive affective response to diversity or to someone who is different from you are fear, disdain, disgust, anger, or hatred. We may be struggling just to tolerate being in their presence.
Examples of adaptive affective responses to diversity are acceptance, respect, and empathy, just to select a few that are vital for healthcare providers, in particular.
I think we all want a healthcare provider to listen to us with acceptance, to treat us with respect, and to listen to what we are saying with empathy for our situation, like a situation where we are adjusting to a new condition or diagnosis.
Now, let's go to the letter B, or behavior. Now, think about your behavioral responses to the stress of encountering someone who is different from you, perhaps a patient who is either LGBT or MSM.
Your behavioral responses can either be adaptive or maladaptive.
Examples of maladaptive behavioral responses to diversity are discrimination, or not treating that patient the way you would normally treat any other patient.
Maybe you do not touch the patient when you conduct the physical examination in the way you normally would touch a patient.
Maybe your behavior involves standing further away from the patient than you normally would. Or maybe you cut the therapy session short without realizing it.
Maybe you skip certain assessment questions, or neglect to order certain tests, perhaps without realizing it.
Maybe your behavior involves not following all the steps in your normal protocol for patients. Or maybe your behavior involves deviating from a standard protocol in some way that actually constitutes discrimination, or might even mean an error has been made.
The results could also result in a disparity in service delivery. It might mean that you have actually contributed to a racial, ethnic, or other disparity in healthcare service delivery.
Your LGBT or MSM patient, for example, has just experienced a disparity or inequity in healthcare service delivery. And they might not even know it. All they know is that they felt a bad vibe, or picked up some bad feeling in that office. Or maybe they felt the provider was being distant, or they just feel like they do not want to return to that office, not knowing why.
Or maybe they do not feel anything in particular, yet, without either knowing or feeling it, they just experience discrimination. They just experience deviation from the evidence-based standards of care.
The deviation away from evidence-based standards of care, or deviation away from standard protocols, might mean that a test is not performed, or a test is not ordered, or an underlying condition is not properly detected and not treated.
The results of the disparity in healthcare service delivery might translate into disparities in health status. This health disparity might show up when the LGBT or MSM patients' outcomes are compared to those patients who received treatment that was consistent with the evidence-based standards of care, whether standard protocols were followed.
Thus, engaging in maladaptive behavioral responses to diversity, when you are the healthcare provider, can have potentially devastating consequences.
Now, we can talk about what happens when adaptive responses are made instead of maladaptive ones.
Examples of adaptive behavioral responses to diversity are delivering healthcare that adheres to the evidence-based standard of care, or one adheres to the standard protocol normally followed.
The results will be equity in healthcare service delivery. The patient experiences equity in healthcare service delivery.
Many factors may contribute to the root causes of health disparities. However, by following evidence-based standard of care and adhering to the standard protocol normally followed, healthcare providers can at least reduce the chances that their behavior is contributing to health disparities.
Now, let's go to the letter C, or cognitions.
Now, think about your cognitive responses to the potential stress of encountering someone who is different from you, perhaps a patient who is either LGBT or MSM.
Your cognitive responses or thoughts can either be adaptive or maladaptive.
Examples of maladaptive cognitive responses to diversity are having thoughts that reflect stigmatization of the patient, or having thoughts that are stereotypical or involve stereotypes. Research shows that sometimes such stereotypes arise automatically in providers and contribute to how patients are treated.
Our cognitions, or thoughts, may involve those socially conditioned cognitions, or socially conditioned thoughts that we learn by virtue of living in this society.
These thoughts, or stereotypes, may just pop into our head when we see or are interacting with someone who is diverse or different from us. We already talked about this earlier in the video.
These stereotypes can also mean that we have stigmatized the patient by viewing them through the lens of the negative stereotype.
We may think all patients like this usually use drugs, so maybe the medical condition, or the story they are telling us really involves the impact of the patient using drugs.
Or, we may go on to think that all patients who use drugs are liars, so we do not take the patient seriously.
These stereotypes that just pop into our head, or these maladaptive thoughts or cognitions may lead to maladaptive behavioral responses, like the provider not following the standard protocol, not ordering certain tests, or not delivering the evidence-based standard of care.
These stereotypes that pop into our head, or these maladaptive thoughts or cognitions may also lead to maladaptive affective responses, like having negative feelings toward the patient, because we have stereotyped the patient as being a drug user and a liar. Then we may feel the effect, or feeling of disdain, or we may feel fear, disgust, anger, or hatred.
We might become angry because we think that patients like this one are always lying to us.
We may cut short our assessment and deviate from the standard protocol for healthcare delivery.
In summary, maladaptive responses to diversity can involve the maladaptive affective response of disdain, the maladaptive behavioral response of discrimination, and the maladaptive cognitive response of stigmatization by stereotyping patients.
These are old A, B, C's that society taught us which no longer serve us well. Those old A, B, C's do not benefit us at all in our new diverse society. We all have to learn a new set of A, B, C's.
As we conclude this virtual grand rounds, let us summarize.
The goal is for healthcare providers to practice having adaptive responses to diversity.
Here, we speak of the adaptive affective responses that we mentioned before, such as compassion, understanding, and empathy. Or, practice the adaptive affective responses of acceptance, respect, and empathy, to be discussed in the next video.
We all want to practice the adaptive behavioral responses of adhering to evidence-based standards of care and following standard protocols in healthcare service delivery.
We want to all practice the adaptive cognitive responses of merely thinking thoughts that are consistent with the standard protocol we are supposed to be following.
For example, adaptive cognitive responses include thinking the following: it is time to ask this question, or I observe this about the patient, so it is time to ask this question, or, given what I am seeing, it is best to order this test now.
Adaptive cognitive responses also involve being curious and wondering about the worldview, life, room, and experience of the patient sitting before us in the consultation room. We wonder about what we need to know about their worldview, life, and experience that might guide us in providing the very treatment to the patient.
Most importantly, our cognitions, or thoughts, are free and void of any stereotypes or stigmatizing thoughts.
These are the new A, B, C's that we have to learn in order to work effectively and successfully as healthcare providers in our new diverse society.
Watching these videos can be considered doing your essential homework to learn a new set of A, B, C's.
The goal is to learn a new set of A, B, C's, or to learn new adaptive affective responses, new adaptive behavioral responses, and new adaptive cognitive responses to the diversity we encounter in our patients.
In our increasingly diverse society, we must learn that different does not mean wrong. Different does not mean inferior. Different does not mean bad. Then, we must learn to execute adaptive responses to diversity and difference.
Not all of us experience interacting with a diverse LGBT or MSM patient as stressful. However, for some providers, it may be. It is okay to acknowledge any stress that you may feel.
Once you acquire cultural competence, then such interactions should be free of stress. However, it may be a journey to arrive at that goal.
In another video that will follow, in the sequence, you will learn how to catch yourself in the act of having an automatic conditioned or difference that is maladaptive. You will learn how to stop yourself and train yourself to have an adaptive response.
But, first, let us elaborate on the highly recommended adaptive affective responses of acceptance, respect, and empathy in the next video.